Sacral Neuromodulation, and for this I'd like to call on stage Dr. Basavaraj Neelagar, Additional Director, Urology, Uro-Oncology, Andrology, Kidney Transplant and Robotic Surgery at Fortis Hospitals, Bengaluru.
So we all have heard about the pacemaker for the bladder, for the heart, but what about the pacemaker for the bladder? So I'm going to tell about the pacemaker for the bladder in brief. So bladder is a unique organ, intra-abdominal organ, which out of the 24 hours in a day, 23 and a half hours, it holds the urine, it receives the urine from the kidneys. Only for the remaining 30 minutes, it contracts and pushes the urine out. What will happen if it works too much or if it doesn't work at all? That's when the bladder-related issues can crop up, either overactive bladder or underactive or acontractile bladder. Initially, we treat them with medicines, but what if the medicines are also worsen the quality of your life along with the problem? So that's when the sacral neuromodulation comes. It is a simple yet sophisticated solution for the refractory bladder, wherein it sends electrical impulses to the sacral nerve through a implanted battery. So we all know the pudendal nerve controls the pelvic organs, out of which the S3 nerve is the nerve of interest where we target the S3 nerve root. We place the lead over there. So what are the indications for the procedure? The most common indications are overactive bladder, which can be either wet with associated with urgency incontinence or with dry overactive bladder, or non-obstructive urinary retention, that is detrusor or hypocontractility or Fowler syndrome in women, and fecal incontinence of any cause. Other conditions which are off-label indications like chronic constipation, pelvic pain syndrome. Okay, to understand the problem, why these therapies are important, we need to understand the magnitude of the problem. If you look at the numbers, overactive bladder, it is a highly prevalent but yet undertreated and underreported disease. If you look at the population of the Europe, out of 400 million people, nearly 7.4 million people would have tried all the possible therapies, but they are not happy either with the relief they get or they're not happy with the side effects. So these 7.4 million people require some kind of advanced therapy. This is the use of CIC, that is underactive bladder. The only option available now is clean intermittent catheterization, wherein patients are not able to pass the urine out, so they have to put the catheter by themselves. We don't have Indian data, but you can extrapolate. At present, the incidence of diabetes in India is about 15 crores. 15 crore people suffer from diabetes in India. Nearly 30 to 90% of these people will end up having diabetic cystopathy, which doesn't have any treatment apart from clean intermittent catheterization or a medication which is as good as placebo. So this is where the sacral neuromodulation comes into picture. It's a very effective treatment for underactive bladder also. Mechanism of action.
Overactive bladder, or OAB, is a urologic condition defined by urinary urgency with or without incontinence, urinary frequency, and/or nocturia. OAB affects about 37.4 million adults in the OAB patients. Brain activity has shown abnormal responses in areas of the brain believed to be important in recognizing urge and frequency, and decreased activity in areas believed